Contessa, the World Health Organization has declared the coronavirus outbreak a public health emergency of international concern. They are saying they are doing this not because they don't have confidence in the way China is responding to this outbreak, but because of the concern that it could spread to countries with weaker healthcare systems. Remember, they met for 2 days last week and declined to declare this that public health emergency of international concern. And now they are doing so after seeing the broader spread. And again, as they say, they are worried it could spread to countries that aren't as well prepared to deal with it. Now we are waiting to hear whether they make any recommendations in regards to travel and trade. What this declaration allows the WHO to do is gives it further purview to make those kinds of recommendations internationally. So we will wait to hear those. And I'm hearing we do have the sound of them making the declaration. Listen to what the WHO Director General said.
Of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it. Let me be.
So that's the Director General, Dr. Tedros Ghebreyesus, there saying again this is not because of China's response. And he actually went out of his way to commend China, saying they may even be setting a new standard for outbreak response, guys. But we are getting that public health emergency of international concern declaration for this novel coronavirus. Back over to you.
That might be important because of the skepticism that people who have worked in China in the past are bringing to bear when they're looking at the numbers and then China's response. In the meantime, this declaration by the World Health Organization, especially where it comes to other countries who may not have such strong health standards, does the World Health Organization have any sort of power over these countries, or is it just influence?
That's a really good way of putting the question, Contessa. It doesn't necessarily have authority to do things in those countries, but this declaration does give it a sort of more cover to make recommendations and to strongly emphasize they should be taken. And we will see whether they recommend any changes to travel and trade based on this. We haven't often seen them do that before for concerns over whether that could affect countries' willingness to report things accurately. So we'll wait and bring you that news when we get it.
Meg, quickly, what conclusion, if any, can we draw about the Chinese response to this illness, given the rapid growth from fewer than 100 or so cases a week ago to now in the multiple thousands of cases? Do they have their arms around it or not, or can we conclude?
It's hard to conclude, Tyler, and it's different depending on who you talk to. The World Health Organization is being very clear. They are commending China for this response. Dr. Tedros, in his remarks just now, saying that we would see many more cases around the world and potentially deaths if China hadn't acted the way that it had. However, you do hear some skepticism from folks, including former FDA Commissioner Dr. Scott Gottlieb, who said China is being commended, but only because it's better than how China responded to SARS, not because they are responding in a way, or at least being forthcoming in a way that is good compared to other countries potentially. So that is still sort of the jury's out right now.